What is health informatics? It's defined as the integration of healthcare science, computer science, information science, and cognitive science to assist in the management of healthcare information. In simple terms, health informatics is a collaboration of various sciences to help physicians provide better healthcare. It's a broad field and can come in many different forms, such as nurse informatics that encompasses the study between nurses' interactions with health IT systems and how to better improve them. Or as a clinical data analyst, where they use their knowledge of both healthcare and database management to help identify and report trends. Or as a chief medical information officer that helps design and integrate technology into a physician's workflow. They serve as intermediaries between physicians and IT. Health informatics is a growing field that remains important today and into the future.
So what is important of health informatics? So it fills in the gap that is not fully met by today's technology. From one of the articles, I know that smartphone app can help a lot during the doctor's consultations when it is integrated into the electronic health record. The researcher also said that it is hard for the patient to remember the symptoms, and short consultation times may interfere with the patient's history. And today, more apps available on any type of devices, ranging from your laptop to your wrist health device. And I know that health informatics is trying to innovate apps that allow patients to track easily and more accurately at the exact time of incidents, especially for the special illness. And there's a lot that this field has done, and it is still changing. Other than this, health informatics has implication in many fields. For example, clinical, managerial, and policy implications. And the rest of the video we discussed them.
For the clinical implications, in this day and age, it is pretty evident how the use of informatics is present in healthcare facilities. It is important to understand not only the technology being used, but the workflow and the data collection used to help treat these patients. One thing to point out is the gaps that are present between the technology and data collection process. To do the process, many skills, including storage, extraction, and data collection, are needed, which is where health informatics comes in. In hopes of reaching the goal of closing this gap, President Obama signed the ARRA in 2009. This includes the HITECH, which is the Health Information Technology for Economic Clinical Health Use Act. This act includes the MU, which incentivizes healthcare providers to use EHR, electronic health records, and penalizes them when it isn't. This resulted in an influx of healthcare professionals in the medical field.
Time management is a prevalent issue in healthcare setting. Thus, the use of informatics to aid and organize and not create barriers is essential. However, healthcare professionals need to ensure that they are utilizing informatics to aid their work and time management, but not impeding them. It is highly important that healthcare information systems are accessible and readily usable to support managers and their subordinates, taking into consideration the limit is the standard their work has. For instance, managerial programming facilitates payroll functions, streamline material control, and assist with financial and administrative factors of their role. Healthcare information system can improve communication, time management, and delivery of information among staff and patients.
Medical informatics has significant implications in public policy, specifically the ability of policymakers to interpret, communicate, and utilize public informatics health data. Furthermore, this public health data must also be protected by policymakers, as liability, privacy, and confidentiality are raised when this data is analyzed. A risk that arises if policymakers are not able to thoroughly understand public health record data, patient portals, and other data sources is that they cannot be expected then to make valid judgments when voting on new laws. As a result, some organizations, such as the American Medical Informatics Association, the AMIA, discuss the potential issues with health informatics data and develop plans and reports to present to said policymakers. Similarly, questions have been raised at which level medical informatics without proper guidelines will develop into a proprietary system, leading to non-interoperable health information infrastructure that cannot cross state lines and thus does not contribute to its full utility to federal policymakers. Solutions to these risks and issues in public policy are primarily the creation of guidelines and increased communication in general and of these guidelines from medical informatics professional organizations to policymakers.